What is basal bolus insulin? What is a basal bolus insulin regime? Basal insulin and bolus insulin are two different types of insulin that make up a basal bolus insulin regime. These insulins work together to control your blood glucose levels. A basal insulin is a long-acting insulin and bolus insulin is a quick-acting insulin. Some examples of basal insulin are Lantus, Abasaglar, Tresiba, Toujeo, and Levemir. Some examples of bolus insulin are Novorapid, Humalog, Apidra, and Fiasp. Your basal insulin should provide you with insulin throughout the whole 24 hours of the day. This is the same as what the pancreas would do in someone who doesn't have diabetes, as their body will constantly be producing a small amount of insulin, which works to keep their blood glucose levels stable when they are not eating. You must take basal insulin at a similar time every single day. This is to make sure you always have insulin on board. Your basal insulin is the foundation of your diabetes control, as it gives you steady blood glucose levels during the times that you are not eating, such as overnight. Once you get your basal insulin dose right, you can then focus on getting your bolus insulin dose right. It is important to check you are on the right amount of basal insulin. Your blood glucose levels before bed should be within 1 to 1.5 of your morning glucose levels, which you take before you eat anything in the morning. To get this right, check your blood glucose levels before bed at least 4 hours after your evening meal. This is to make sure you do not have any bolus insulin on board, so the only insulin responsible for managing your blood glucose levels overnight is your basal insulin. Also, make sure you have not had any alcohol or done any more physical activity than usual, as this can affect your blood glucose levels. If your blood glucose levels go up overnight and are above your target in the morning, then you are not on enough basal insulin. If your blood glucose levels go down overnight and are below your target in the morning, then you are on too much basal insulin. We advise that you adjust your basal insulin by 10 to 20% at a time. So for example, we have Tom. Tom has type 1 diabetes. Tom's basal insulin is Abasaglar, 20 units once a day. Tom's blood glucose level is 8 before he goes to bed, and it is 9 the following morning. As this is within the 1 to 1.5 range, he does not need to change his basal insulin. But if, for example, Tom's morning blood glucose level is 12, then he would need to increase his basal insulin, as his blood glucose level has gone up more than 1.5 overnight. As Tom is currently on 20 units of basal insulin, 10% of 20 units is 2 units, and 20% of 20 units is 4 units. So he would need to increase his basal insulin up to either 22 or 24 units. Before adjusting your basal insulin, it is important that you wait to see if a pattern occurs over 2 to 3 days, as some days your blood glucose levels may be above or below your target range, due to different factors. If you are on Tresiba or Toujeo, these basal insulins will last a little bit longer than the other basal insulins, so wait at least 5 to 7 days before making any changes to the doses. It is important to note, if your blood glucose level is less than 4 when you wake up in the morning, you can reduce your basal insulin straight away. Your bolus insulin is given on top of your basal insulin. This is injected to cover the carbohydrates that you eat throughout the day. For example, your breakfast, your lunch, and your evening meal. Your bolus insulin is given to try and stop your blood glucose levels going up above your target range after your meal. However, you don't have to have 3 set meals during the day if you don't want to. You can be very flexible with the meals that you eat throughout the day. Most bolus insulins, for example Novorapid, Humalog and Apidra, should be given 15 minutes before a meal. This is to give the insulin time to be absorbed and to start working when you start to eat your food, and as a result should prevent a large rise in your blood glucose levels after meals. However, if you are on Fiasp for your bolus insulin, you should give this just before meals. In the next video, we will start to look at carbohydrate awareness, including which foods to count when carbohydrate counting.